Our patient today is undergoing gender transformation. About 10 years ago, she started her hormone therapy, and now she's ready to have what we call lipo-feminization, which is using liposuction and fat transfer to transform a masculine body to more of a feminine body. And as you know, a masculine body is very linear and a V shape, and a feminine body is beautiful and curvy. So our plan of surgery would be large volume liposuction of the whole back area. The entire back will be liposuction, starting with the upper back, mid-back, lower back, love handles, sacrum, with the intention of removing about 5 liters, at least 5 liters of fat, which is what large volume liposuction is, and creating a feminine concavity of the waist area and then the lower back. Then the fat will be transferred into the buttock areas and the hip areas, because we want to create hips and fullness of the buttocks, so that we transform a masculine body to more of a feminine body. We will have to chase this in the front. I always talk about 360-degree correction, but today I'm limited by the amount of fat that I can remove. Large volume liposuction is limited to 5 liters, and if you do more than 5 liters, the patient has to be admitted to the hospital, which is way too expensive. So what we normally do in my practice is I do 5 liters and then come back and complete the work in the front if needed with another 3 or 4 or 5 liters. And the advantage is that if she decides to use that fat in the front for enhancement of the breast area or the buttock area or the hip area, we can do that again. Especially the hip area and the breast areas don't take fat very well, and you only get about half of the fat ultimately surviving, whereas in the butt you get about 75 to 80% of it surviving. So with that said, let's get started. So here you go. Today we perform large volume liposuction, which is about 5 liters of liposuction of our patient's back. This is a gender transformation lipo-feminization, meaning that we wanted to convert and transform a masculine body to more of a feminine body. Our patient has been on hormone therapy for about 10 years and was now ready to complete the rest of her transformation. And today we hopefully helped her with her goal, and liposuction over about 5 liters from her upper back, mid-back, lower back, love handles, sacrum, which is this area up here, and transformed all of that fat into the buttock region to create roundness, fullness, a feminine buttock shape, and hips at the same time. Not such an easy procedure as it is on a female patient, because the connective tissue in a male skin is much thicker, and therefore you still see some dimplings. Those dimplings represent the connective tissue attachment to the skin, and over time they will be softer, and as the fat kind of molds itself in place, it will become less visible and appreciated. But overall, you can appreciate her beautiful hourglass look that was created today. I think she'll be super happy. I'm super happy with her results.